talk to you a little bit about an upcoming event that we have coming up. It's a live online patient educational opportunity for you to join me to learn more about how to keep your joints healthy while living with a bleeding disorder. This event is one that's near and dear to my heart as a person living with a bleeding disorder, and I'm really excited to bring an amazing group of people together to talk a little bit more about how important it is to be able to keep your joints healthy and protected over long periods of time. It really starts with prevention, but it continues on through consistency. And we want to make certain that you can join us for this amazing event. You know, we got some amazing speakers lined up for this event that I'm super excited about. We'll cover some really important topics like hemoarthritis and how blood shouldn't be in the joint capsule. We're going to be talking about target joints and how to avoid that and what to do if you have them. We're going to be also talking about pain relief. We'll be talking about how to use ultrasound as a way to measure damage and changes in the anatomical structure within your joint capsule. And then we're going to also be covering things like mental health and how to really manage through diet and exercise some of those difficulties. We'll also be talking about prophylaxis and the importance of consistency and all kinds of things. And really, ultimately, living a life without boundaries. That's what it's all about. Today, with access to medication and consistency, you can live a fully successful life with a bleeding disorder, and we want to help you do that. I've got some amazing guests that are coming to this event. I want you to be a part of it. We're going to have a lot of fun together. But today, I've invited a good friend of mine to come and join me to talk about on this pre-event podcast a little bit about one of the sessions that he's going to be talking about. Many of you know and love our good friend, Dr. Claudio Sandoval. Dr. Claudio, it's great to see you today. Thanks for joining me for this pre-event podcast.
Thank you very much, Jonathan. It's always a pleasure to hang out with you. And as I've said to you many times, being part of this Hope's Charity has been one of the highlights of my academic career. And I mean that wholeheartedly. I truly just love hanging out with you all.
Well, we feel the same about you. You know, everyone that we've talked to seems like they have such great feedback about the sessions that you always bring with such great information. You communicate with such incredible passion and really a way that any kind of person can really understand the clinical side of things because they're so complex, but you do such a great job of explaining it. And I always feel so encouraged and inspired every time you talk. But, you know, you've got 2 sessions coming up at this event, which I'm really excited about. The first session is one that I wanted to bring up that's going to be happening at 1 o'clock on Tuesday, September 26th. Tell me a little bit about this session, and it's going to be talking about really the anatomy of target joints, right?
Yeah, so what we're going to do is, the knee, people think is just bones, but it's really the muscles around the bones, the tendons that attach the muscles to the bones, the ligaments that attach bones to bones. The knee is unique in one sense, Jonathan, that it actually has a cushion. It's called meniscus. No other joint has that. It's quite remarkable. But that cushion is vulnerable to bleeding. So if you were to get an injury of your anterior cruciate ligament, well, that's going to lift up. It's going to lift up the cushion, and the cushion's going to bleed. So I really want to just kind of talk about how important the knee is to us who walk on, who are bipedal. Even though Leonardo da Vinci said that the foot was the most amazing machine he ever studied, I think the knee is equally important.
That's so great. Well, I know a lot of folks that have had trouble with their knees being target joints at a very early age. I do think that that's something that is a huge problem for a lot of folks, but it's something that I do think that also is not going away. We have a lot of people that are on treatment today that have really gotten to the point where they maintain mild hemophilia on a day-to-day basis with their factor levels, but oftentimes I argue that a very long journey over time that we're still seeing people with mild hemophilia that are having joint damage and joint disease, and really get to know that a mild level or above mid-level, they actually may be having knee replacements done at 35 or 40 years old. And we want to try to avoid that at all costs if possible. And I think the knee is a great platform to really address this topic because it's so appropriate for you to bring this because I think it's important for all of us to talk about.
Yeah, I just to add to that, we have Dr. Marjorie Hunt, who's going to talk about prophylaxis and how can we prevent this from happening.
Yeah, we always love from hearing from her as well. And I know that there's other sessions that you're going to be talking about is really addressing the pain relief aspects of things, talking about radiosynovectomies, NSAIDs, things like that as well. And those topics and types of treatment plans have really changed a little bit over the years. So I'm really excited that you're going to be talking about that.
Right. So, whenever we have pain, that's pain was kind of given to us as a way to avoid behavior. So if I put my hand on a stove, I'm going to get pain. I'm not going to do that again. If I'm working too hard and I'm experiencing pain, that's my body telling me I need to slow down. So it's kind of a endowment to prevent you from getting hurt, let's say. But so when we talk about pain and folks who have hemophilia may experience pain, we want to make sure that their pain is relieved, so that they can carry on the activities of life. And you may not think of prophylaxis as a pain relief, but it really is. It's a way of preventing pain. We'll talk about, as you said, the NSAIDs and Tylenol. We're even going to talk about narcotics and how potentially dangerous they can be. And we'll talk about other things, and then we're going to have Dr. Reyes talk about nutrition and exercise. Again, Dr. Mike talk about physical therapy. Dr. Marjorie Hunt talk about prophylaxis. Then we have Dr. Griggs talking about what happens when blood gets into the knee joint. So we're really going to take a holistic approach to how we can improve the lives of folks with hemophilia, and hopefully get them back on their 2 feet and enjoy life.
I love that. And I'm really excited about the whole 360-degree view of how to live a successful life with a bleeding disorder. I think joint disease in general is still a thing that we have to be very, very, very conscious of, but it can only be done with the right information, the right application of that education that we receive. And so that's one of the reasons why I'm so excited about doing this event with you. And I want to say a big thank you to you as well as Octapharma. You guys are one of the best at bringing some amazing educational information like this. And I do believe that it's been just exciting to have an incredible partnership to work on projects like this to bring the best educational content we can to the patient population so that we can all have a better way to be able to navigate these really intricate issues facing the bleeding disorder community. So thank you so much for your partnership for this event, and I look forward to seeing you very soon.
Of course, my pleasure. And I'll see you soon. Take care, man.
Awesome. Well, big thank you to Dr. Claudio for joining me today on this podcast. I think there's a lot of great content coming our way, and he's been such a dear friend and really a partner to be able to bring some amazing education. As I mentioned earlier, we have 2 sessions that he'll be doing on September 26th, and it's going to be on pain relief. And then immediately after that, he's going to be doing one on the knee, talking about the target joints and how to avoid that and what to do if you have those issues going on. Immediately after the pain session, I think both of those are going to be phenomenal. And this event is going to be live. So there's going to be live Q&A. So immediately after his sessions, you're going to be able to ask him questions, kind of ask the expert moment. I think this is an important time. If you have questions already, bring them, write them down so that you can remind yourself what to ask. Also, you might be in the session and thinking of things. I always encourage people to put them in the chat. We'll make sure that we keep track of those so that we can invite those questions at the appropriate time. But I want to make certain that you're there live, because that's really when you get the most value out of these moments, is being able to capture that. And these sessions will not be available after the fact immediately. So we want to make certain that you have the best information possible to be able to get that in that live setting. Plus, we're going to have a ton of fun. We're going to be doing drawings and giveaways and raffles and gift cards, and it's going to be a blast. Not to mention the fact that I think one of the bigger advantages of being there is that you get to meet other people who are living with the same bleeding disorder as you from all over the country. At our last event, we had an average of about 60 or 70 people that participated in every single session, and there was people from all over the country, about 42 different states participating. So really a great time to meet people from a broad array of going through living life with a rare bleeding disorder. So we certainly hope that you'll carve out some time to join us on September 26th and 27th, and you have to register to do that. So I want to make sure you go to the website and you register right now at hope-charities.org or hope-charities.org, whichever you prefer, and it'll take you right to the homepage. And right there on the homepage, you can click on that link and sign up right now, and we would love to see you very soon. Thanks for joining me for this pre-event podcast today, and we look forward to seeing you right around the corner. Take